Hello, my name is Todd Miller and I am a managing consultant in the Employer Services Division at the Partners Group. We are a employee benefits, commercial insurance and financial services consulting firm. And today we're going to talk about 3 ways that you can help mitigate your upcoming medical renewal increase. As January approaches, approximately 70% of the employers who offer health insurance to their employees are getting ready to begin their renewal process. Most organizations feel like they have very little control or insight into why their premiums continue to rise, which really makes budgeting for healthcare very difficult to do. The first item we're going to discuss today is kind of a no-brainer. You need to understand your options and negotiate. Now, many employers that are going through the renewal process are faced with the imminent question: to bid or not to bid. Insurance carriers will often offer some type of reduction to the renewal if the employer is willing to forego a market review. But how do you know you're getting the best deal? If you have access to your claims data or you work with a sophisticated insurance broker, there should never be a surprise at the renewal time. However, many employers don't have access to their data, or they work with a broker who relies on the insurance carrier to do the underwriting for them. Now, insurance carriers will typically have a really good rationale on why you need the rate increase. You had that one large claim, or hey, your population's getting older. However, a good broker should be able to point out considerations the insurance company should take to help lower your premiums. They should be well versed in market trends to make sure you're getting the best pricing, terms, and conditions the market has to offer, and they should try to get those locked in on a multi-year rate guarantee, if at all possible. The second item I wanted to talk about today is you should really consider a refunding contract. You heard me, a refunding contract. And all that means is a way that you can buy health insurance on a contract that will actually give you money back at the end of a 12-month period of time. Let me explain. It's been really interesting. Over the past 4 years, we've seen a major shift into how employers can actually buy health insurance in our region. Historically, most employers bought health insurance from an insurance carrier on what's called a fully insured contract by paying a fixed monthly premium based on enrollment, and typically had little or no access to their claims data. Now, the renewal gets released, all of a sudden it's a mad scramble to look for more cost-effective options in the market. Now, any employer with 25 or more employees has the ability to buy health insurance on a refunding contract that's still paid with fixed monthly premiums. But it also gives the employer the opportunity to get money back. The other nice thing about these is it also gives the employer access to the claims data so they have a clear understanding of how the plan is performing, which really takes any surprise out of a renewal away. Now, as you consider these refunding contracts, you need to make sure that you're working with a broker who clearly understands the benefit and pitfalls of each, and they make you aware of those before you get into them. The final item that I wanted to discuss today is you should really take a look at a high-performing health network. It's been fascinating to watch over the past few years. These health insurance carriers from across the nation started developing high-performing networks. Some people call them narrow networks, some people call them accountable care organizations, but really what they are is they are smaller networks that steer members to high-value healthcare providers. Typically, hospitals and providers who participate in these high-performing networks have some type of financial incentive that's tied to the health outcomes of their patients. In the Pacific Northwest, we've seen insurance carriers provide a 10% premium differential just based on the network. And what I mean by that is if you go to the traditional network, and let's say you're spending $1 million a year for your health insurance from an employer standpoint, just by implementing one of these high-value networks, that could save your overall cost of about $100,000. So we're talking real money. Now, there's been a lot of adoption here in the Pacific Northwest. However, there are a few things that you need to consider prior to implementing one of these types of networks. Saving money is awesome, but you need to clearly understand what, if any, impact the narrow network is going to have on your employee population, and you got to implement strategies to lessen that impact. Thank you for taking the time to join us for our webinar today. There will be a form that pops up at the end of our session, and we'd love to get some feedback or some additional detail on more information that you'd like to learn about. If you have any questions or comments about any of the information that I covered today, feel free to reach out to me directly or anyone at the Partners Group. Thank you so much for joining, and have a great rest of your day.